Good afternoon, you're watching On Point. I'm Nompumelelo Siziba. Without any further ado, we're going to go straight to the Health Minister, Dr. Zweli Mkhize. My colleague Sipho Stuurman is interviewing him right now.
We're in the line to serve. So we do expect that if there are shortages, they must be addressed. Now, in all over the country, we are actually encouraging even staff members, unions, to come forward. Where they're worried about the shortage of PPEs, that they must explain that, so that we must be able to make sure the distribution is adequate. The issue of vaccine, it's important to say that the vaccines go through quite a number of steps of development with various trials. You have to do some work in the laboratory. There's a time where we do the research at a laboratory, and it's just restricted to that. Then you move from there. In some instances, you have to go to animal studies, and when it passes through that, then you have to take the next step of doing the phase 1 of human trials, and this tends to be very limited and contained, and this is where you get volunteers who are generally healthy, where they want to make sure that the vaccine doesn't elicit any negative responses, and that amongst the individuals, the response that is expected in the body of the individual is elicited. There's nothing that is untoward. That is what Russia has been able to do. Beyond that point, there's another, the second phase, which now must take into account, the wide use, the various changes, the climatic conditions, the various comorbidities and other conditions that could be affecting the development of the immunity. That stage is something that will have to be done as another phase. So yes, there are trials that are going on. We are already having a team here in South Africa that's involved in the trial, led by the team from WITS. We have seen that working with Oxford University. Same trial is going on in the US and the UK and in Brazil and other countries. So there are going to be many different trials that are going to be taking place, largely under the WHO, which is going to be guiding. We're not yet at a point where we've got a vaccine that is ready. It's good news, yes, but it's work in progress. So in another year and a half or two, we might probably find that there's conclusion where there are vaccines that are fully proven on the second phase of their trials, where we've now been able to establish without any doubt that they can now be produced in millions of quantities, so that they are now able to be used for the whole world. So I think we must watch this space. It's still early days. It's good work that's been done in Russia, but we haven't come to a point where we can just go to Russia and source a vaccine and use it for South Africans. But there's good work there. We're watching all the research. We'll also participate in some of them.
From ENCA. Minister, we just want to know, we understand at this point that the taxis are allowed to have 100% capacity. But if the virus is airborne, or is it not, why are we not worried about the passengers' safety?
We are worried about everybody in South Africa. We're worried about everyone, and we want everyone to take the precautions. There isn't any part of the country where we think people must just get infected. We wouldn't actually want anyone to be infected. In the case of the taxis, a number of things have actually gone into. We have sat down together and went through quite a lot of consultations to look at the studies of what happened in the various countries. So a number of things have been put onto the table as to what can work. Now, the worst case scenario of how the infection would go on in a taxi is a situation where the taxi is full, people are not wearing masks, and those who are infected are coughing, they are not observing cough etiquette, and that their hands are not sanitized, and everybody is sitting there, the windows are closed. Then that pressure is actually going to give you the highest amount of infection. We have therefore sought to mitigate against that. Amongst the issues, now we've looked at the sustainability of the taxis, the work that has been done by the Department of Transport to look at what numbers of people would actually sustain the industry. Forget about the taxi operator. Let's talk about the industry, objectively now assessed by the department. They realize that what is being proposed will not make it possible to get the taxis to run every day. So we've reached out then to say, okay, let's then look at a number of mitigating steps which are going to negate all of the things that I said are causative factors for the infection to rise. Number one, everyone who must go into the taxi must have a mask. We will actually take action on the operator who will not insist on people putting on a mask. That's why we've put it that way. That's why we've put it that the owners, the managers of buildings must be the ones who must insist on enforcing the use of masks. So that's the one issue. The issue of hand sanitizers is also important because the handles of the vehicle is where people can actually exchange, contamination and therefore can get infection. So then they must actually take care of that and make sure that people's hands are sanitized. Thirdly, when they go inside, because distancing is not possible, then we've said they must open the windows. Now there's a degree of opening of the windows that is enough to create the flow of air so that the outside air can ventilate and push the air out of the vehicle enough to ensure that the droplets don't have time to settle on the individual. Mind you, with the mask already, it means that if you've got no mask, it's 100% chance of transmission. If you've got a mask and you've got the infection, the other person has got, we reduce the infection chances by about 70%. If the other person has also got the mask, you reduce it by another further 15%, which therefore means ultimately the infection rate, the infection risk is much lower. Now, once you put up the taxi, open up the windows of the taxis, it allows the air to move so that the droplets don't actually stay in the taxi. So we believe that there's quite adequate support to ensure the reduction. Now there's been studies that have been done, and I can quote a few papers for you. One was done by two guys, Matosa and Munyaratsi, who were doing it in the Western Cape, and they went into the taxis to look at the risk of lack of ventilation in the taxis. They actually came out with very interesting studies, and amongst them they put up 14 volunteers, filled up a taxi, and then studied the flow of air and the impact on the passengers. They were able to determine that you don't even need to open all the windows on the taxi. We've got 6 windows, you just only need to open 2 and 2 on both sides, and also you don't want to open all the windows, you want to open them slightly so that there's a direction of the draft of air inside the vehicle and it takes the air out. Now, we have then discussed with the taxi industry, and we've said to them, we will then insist on stoppers that will block a certain number of centimeters of the windows so that it's open. This therefore reduces the discomfort of the occupants, but it allows the draft of the air. It also depends on what speed at which the vehicle is moving. They actually found in that study that the ventilation in some of the taxis is even better than the standard that's been put by the WHO in terms of what the flow of air should be inside the taxi. So we think it's a very responsible approach that we have taken. So we have therefore, the taxi operators, the taxi Santaco, NTA, their argument was, okay, how much is it going to be? Very costly. And we said all we want to do is to put a stopper that neither the operator nor the passengers can interfere with the movement of the window, just enough to be able to get the window to open. We'll obviously go into that with that approach. So from where as far as we're concerned, we think that there are enough mitigating factors that we have put in place to reduce the risk. So it's not irresponsible. I think what people confuse is when the taxi operators, at some point they were quite belligerent. They went out and said, we'll do 100%, we won't agree to this and so on. But we were later informed they had a good meeting with the minister. Certainly the National Coronavirus Command Council, when they received the report from the minister, I was assigned together with the minister and some members of the Ministerial Advisory Committee to go through and explain what is the problem. When the leaders of the taxi industry understood, they said, look, we were not aware that the risk is so much, we're going to cooperate. And in that process, we didn't have anyone who was going to insist on their own way. They were prepared to cooperate. Of course, we'll come back and announce, so we'll hear what they've got to say. But as far as we're concerned, we think that it's a responsible approach that we have taken. It takes into account the fact that we don't necessarily want wide open windows. We just need a few centimeters that will be determined is going to be able to help us. But because those studies have been done, we actually feel fairly comfortable that just this angle of ventilation will also make a huge impact in reducing the impact, whether it's a droplet or it's airborne, it should be able to assist us. They did the same study on the basis of viral infection, on the basis of tuberculosis. In fact, these studies were done at the time when they were worried about multiple drug-resistant tuberculosis, and that's why there's quite a lot of studies that have looked into the value of ventilation in the taxis, and I can share that with you.
Lastly, Minister, I'd like to know, please. Lastly, Minister, just on oxygen and ventilation, should we hit our peak? Do we have enough?
The current supplies of oxygen and the medical facilities are less than what we will need at our peak. So we're going into a discussion to do a number of things. We're working with the industry now to increase their production, and we're in touch, and they're actually doing that. We're also working with the industry to divert the use of oxygen for health use and not for industrial use. So those two together are going to go a long way towards solving our problems.
I just want to clarify, so you said there is enough beds. The blockage is where people need to be to see whether they are symptomatic or not.
Now we just said that at the moment we have not breached our bed capacity in Gauteng. What we have is that the blockages are the delays in the triaging, simply because some people might take longer to be moved from the ward where it's for observation to a ward where it's COVID negative or COVID positive. That's all.
And when we breach our peak, I just heard the name of the workers of the state.
All right, well, that is Health Minister Dr. Zweli Mkhize just briefing the media here after coming to George Mukhari Hospital here in Tshwane, observing the preparations by the hospital. Of course, we know that Gauteng is now the epicenter with over 100,000 confirmed cases. So hospitals now are tasked with the job of making sure that they have enough beds and that their plans are in place. Now, George Mukhari Hospital currently has a bed capacity of about 110, and now the plans that they have in place is to increase that bed capacity to 316. So the Minister and the MEC of Health in Gauteng came to observe those plans and to see if the hospital is keeping up with the demands, as we're seeing the number of COVID-19 cases are increasing, and we understand that currently in this particular hospital, we have about 40 confirmed cases of COVID-19. Others, of course, are people that have come for testing, are awaiting their results. So it was really a trip by government to observe and to ensure that the hospitals have their plans in place. But also, this particular hospital was in the news for one incident where a 2-year-old child, that is a girl child who was in isolation here, was allegedly sexually abused, and while they are at this facility now, that matter is still under investigation. But of course, officials spoke strongly against that, saying that they will increase the security to make sure that children and women that are in isolation, they are protected from any form of abuse. So that was the Health Ministry and the Gauteng Department of Health coming to George Mukhari to observe whether they are, of course, have their plans in place. The hospital plans to increase its bed capacity to 316 beds. Currently, they have a capacity of 110. And with that, it's back to you in studio.
Sipho for that report. Creditors will today vote on